And now it is my honor to introduce our keynote speaker for tonight, Dr. Marco Angulo. As Medical Director for Medical Education and AltaMed's Institute for Health Equity, Dr. Marco Angulo brings an invaluable combination of experience and perspective, thanks to his extensive background in training, teaching, and leadership in a federally qualified health center setting. Dr. Angulo is committed to training the next generation's workforce to serve the medically vulnerable areas of Southern California and throughout the nation. Dr. Angulo's passion for mentoring and training is personal. Born in East Los Angeles to parents who were Mexican immigrants, the future Dr. Angulo knew his life's work was to serve. He graduated from the University of California, Berkeley with a degree in Chicano studies and entered medical school at the University of California, Irvine, where he was selected to be part of the prestigious program in medical education for the Latino community, Prime LC, a program created to develop physician leaders to address Latinx health disparities in the United States and beyond. Dr. Angulo stayed on as a faculty member at the UC Irvine Family Medicine Department and as director of the Prime LC residency program. In addition, he served as the UCI Director of Diversity and Inclusion for the entire medical school. Before joining AltaMed, Dr. Angulo also served as Chief Medical Officer of a federally qualified health center located in Santa Ana, California. Throughout his career, Dr. Angulo has challenged the next generation of physician leaders to chip away at health disparities and develop solutions to lower barriers in patient care. Since joining AltaMed in 2018, Dr. Angulo has been instrumental in building a medical education department, including a new family residency program, a physician and nurse practitioner fellowship, a leadership course for AltaMed physicians, and a nursing workforce pipeline for licensed vocational nurse to registered nurse. In 2021, Dr. Angulo was awarded the California Medical Association's Gary S. Nye Award to honor a physician who has made a significant contribution to physician wellness, and the Clinician of the Year Award from the Association of Clinicians for the Underserved. Not too shabby. Dr. Angulo has been a passionate supporter of MiMentor, and it is my honor to welcome him to our metaphorical stage. Thank you, Dr. Angulo, for being here tonight.
Thank you, Vanessa. Oh my goodness, I was like, who is that guy? Thank you. I'm humbled, and I first off, I just want to say I'm so honored to be here today before so many driven and motivated future healthcare providers, as well as being here with all your coaches and mentors. I see them on the side. The Loezas are here. I see everybody on this chat, so it's going to be great to hear from them that continuously guide us along the way in our journey. My name is Marco Angulo, Dr. Angulo, and I'm a very proud family medicine doctor, and I've dedicated my life to serving the medically underserved communities. That is the only reason why I went to medical school, the only reason. It seems that every day along the way, I have a pinch me moment that I'm really doing this. And I don't want to wake up from this, and this is an absolute dream that I've had. The patients I see day in and day out are a constant reminder of the blood, sweat, and the tears it took to be where I'm at today. And I often get asked the question, was it worth it? Would you do it all over again? Without missing a beat? And the answer is absolutely yes, 100%. So during my 15-year journey from going to community college to graduating from medical school, I've had a lot of time to think about what's important to me in my life and what brings me joy. And I've come to the harsh reality that I am immortal and only have a set time on this earth. So I can't do everything. I can't be everywhere. And I ask myself, what's meaningful in my life? And what am I going to do on this short time I have in this world? And this has brought me to 3 purposes I have in my life. So my number 1 purpose is to be the best husband I can be. I ask myself every day, am I giving 100% to my relationship? If I'm not doing this, my career's over. Before this, anything gets in the way, any career goals. If I'm not doing my job as being the best husband, I'm going to get another job, another career. I'm not going to sacrifice anything for that. The second purpose I have is to give my life service to the medically underserved. I work at a place called AltaMed Health Services, where the mission statement is embedded on the floor of our corporate office. It's the promise to continue to serve the Latino, multi-ethnic, and medically underserved communities of Southern California. And this is my why I do medicine. And the third purpose I have is to help train the next generation of healthcare professionals to serve the medically underserved communities. So we need to bestow the tools that we've learned to our next generation. And this is why when I was asked to be the speaker today by Joanna in this beautiful venue, I responded with an emphatic yes, absolutely. I didn't even think about it. And I did it in less than 2 minutes after reading the email. And to tell you the truth, I didn't even know if I had anything planned for today. I'm glad I didn't have any weddings, any baptisms or anything today. So I figure I just move things around, and this was too important to pass up. So you are the why for me and for many of us who are now professionals set in our careers, and why we keep reaching out and seeing how we can continue to engage, guide, direct, support you in your path so you can fulfill your dreams in whatever you want it to be. So I've been meeting with students for over 25 years. I've served on admissions for 7 years at UC Irvine School of Medicine, and I had many necessary and contentious battles and support of students that some of the on admissions thought would not do well in medical school, um, that are now changing the world as physicians. And I've had the privilege of seeing thousands of students become healthcare professionals, and now working side by side with them as colleagues at AltaMed and throughout the US, knowing them since they were freshmen in college. It's been quite exciting. And I've and thought I've seen it all. But you know what? I've never seen a movement such as this one that you're involved in right now. I've never seen such a push. I mean, it's by any means necessary to make sure that our communities are served by culturally sensitive and holistic healthcare workers. Now, this movement should be coined the MiMentor movement. What every single one of you has done on this platform is giving yourselves to each other. You know, as mentioned earlier today, you've been able to create this amazing community where you share, you foster, and you grow. You've been able to amplify your voice and to make things this lonely path that we once had with people with great hearts and with a desire to serve the most vulnerable communities, and possibly even being the first in your family to take this journey. You've made this place a home for them and for us, a safe space where everyone gets cheered on for success. And you've been able to write your own narrative of this really competitive path and give back to others walking in that pathway. So I have to applaud you for that. When I was coming through the process, we had something called studentdoctor.net. And I'm just kind of remembering, even taking a glimpse of posts on there when I was an undergraduate increased my anxiety by tenfold. I mean, somewhere on there was like, I had a 4.0 and I got a 520 on my MCAT and I was rejected from every medical school. And I remember thinking, what chance do I have? Is there any way, there's no way in heaven that I'm going to go to medical school. And there were people on there just to cast doubts on my hopes and my dreams. And now we have Reddit, we still have probably studentdoctor.net and other social media outlets. And it's so easy to see where people on this journey can get lost and get discouraged, but not you, not MiMentor. What you are a part of it is exactly what our communities need. It's just beautiful on how you've built this. And you've offered inspiring stories, sponsored events so students can have a place to call home. You've made it a friendly place, and you've given it the okay to be vulnerable on this journey, to be human and caring, just like the healthcare professionals you're going to be. And you've changed the narrative from if I get in, and it's changed to when I get in. And you continuously cheer each other on. And in my 20 years plus experience doing this, I have never seen anything like this. This MiMentor movement you've created, you are all part of it. And I believe this is going to change healthcare as we know it. So I'm really proud to be a part of that by any means necessary, because this is our place. These are our communities. This is our house. Nobody does it better than us. Nobody. And you know that. So the past 3 years have been a reminder of all the inequities of our healthcare system, which has been made evident by the way the pandemic has affected different populations. Our communities of color were hit hard during the pandemic. And while most clinics closed shop, I'm proud to say that we worked overtime at AltaMed and in our federally qualified health centers. When the vaccinations were available and distributed to Dodger Stadium and Disneyland, I'm so proud to say that we demanded that we had our own supply of vaccines because we knew where our patients were. This was personal to us. This was our calling. This is why we went to medical school for. What I was so proud of was the overwhelming support we received from volunteers such as yourselves, that you put your life on the line, not to put it on your resume or your application to med school, but to genuinely help, because this was also a calling for you, because you saw what it was doing to our communities, our families, and our loved ones. And I remind all of us, if not us, then who? If not you, then who? Who will do this work? Who do we trust more than us in being leaders in our communities we grew up in? There is no one better than you. And when you doubt yourself, that is a question you should always ask yourself. If not me, then who is going to do this work? And I did want to leave you with a message today. First off, I wanted to thank all of our amazing mentors that are now professionals that have tirelessly given their time to guide and mentor our next generation of healthcare workforce. I just wanted to say thank you, thank you, thank you. I know no one is paying you for this. You do not get a paycheck. You're just paying it forward. Somebody did it for you. And we used to do this, which seemed in a silo, but because of MiMentor, the MiMentor community, it has brought all of us together so we can all see what everybody's doing and share best practices and success stories. And I love it. I don't feel like I'm doing this by myself anymore. I have Dr. Montes over there. I have Dr. Loeza, I have Dr. Casillas. Next, I want to congratulate all the brand new professionals that have graduated from their respective schools or joined the workforce in healthcare. If we have any new grads today, somebody, if you could use your emojis or whatever, let me see some raised hands here in the audience. Anybody new? Be recognized today. You're gonna love your new job. Unless you're going into residency. No, I'm just kidding. Remember to be kind to your patients, but most importantly, be kind to yourself. And I know we have some medical students here, right? It wouldn't be a MiMentor Gala without medical students. So show yourselves too. If you could, let's see some hands raised. If you could raise your hand if you're a medical student, just want to see that you're out there. There's only two things I want to say to you. One is get comfortable being uncomfortable. In other words, expect the unexpected. That way you'll always expect it. And the second one is every day, throw yourself into your work and your studies. You will learn something new each and every day. If you didn't, then you didn't show up. And I want to make sure that you're showing up. Enjoy it, capture it. This is the time you will be making core memories and have mental pictures on your patient's experience, which will last a lifetime in your practice. I've learned so much more from my rotations that weren't family medicine that I still use today in my practice. So, and for those of you that have finally made it through, that have received your acceptance to a professional school, oh my God, congratulations. You did it. Let me see the hands. There are hands out there of the graduating, the people going into the profession. Welcome to the family. You are about to embark on a ride that is absolutely so difficult to describe. Buckle up and enjoy the ride. But before you begin that ride, take this time and relax, relax, relax. This will be one of the last summers of your life, but you won't regret the ride, not one bit. Trust me. Lastly, I wanted to say something to our pre-health students that are here today. I did want to share 3 life lessons that have helped me in my journey throughout medicine that have really taken a load off of my mental burden. And hopefully it gives you something to think about yourself. Number 1, with any dream, you need to be the first to truly believe in it. You need to own it. You need to live it, breathe it, and expect it will happen. You need to rinse and repeat. Rinse and repeat. I'm talking about daily affirmations and convincing yourself that this will happen. Once you start this process, that's when something magical starts happening without you even wanting it to happen. You will believe it with a conviction that you will not let go. And everyone around you will start believing in it too. Oh, and you'll have your naysayers at first, but who cares? It's not their dream, it's yours. And this is where you will continue to grow your team of supporters because everybody wants to be a part of your winning team. I remember when I got into medical school, it seemed that everyone was taking credit for my success at the time. It just showed how much of a support system I had, and I appreciated it so much. So right now, in this chat, we're going to take a minute I want you to do this. Put your name first, last, and comma, and then the degree that you are aiming to get, you're aiming for. Or even if you already have your degree, throw it in there as well. So let's make this public. So if we go on to the chat, I'll be there you go, Vanessa Alvarado, MD. Oh, I love it. Looking at this. Adrian Aranda, MD. Look at that. This is crazy. Erica Venegas, MD. Joanna Gonzalez, Martin Vasquez, MD, MS. Roxana Ramirez Huerta, MD, MS, MBA. That's what I'm talking about. Thank you for doing that. It looks so powerful. I could sleep better now. I know that our communities will be well taken care of. So life lesson number 2. And when I let go of this, I got my life back and I felt I could breathe again. Everyone has their own unique path and journey. You are not behind anyone. Not one person's journey is the same. There is no such thing as a perfect 4-year plan. And I get it. It's this idea that we live with that occasionally creeps up, that doubt that circles us on a constant basis, especially when we begin to compare ourselves with others. It's always about time. When is it going to be my time? How much time is it going to take? Family members asking you, mijo, mija, when are you going to be going on this? Time is running out, looking at their watch. And these are all well-intentioned people. They are people that love us to death. They want to see our utmost happiness, and they do it so we don't get derailed, so we don't lose our sight of what we're doing and keep our goals and dreams. Combat this with a plan. Have a plan. Having a short-term plan and a long-term goal, and sharing this with people that you know have the best intentions for you. People that you call mentors and coaches, the very same ones that you have fostered relationships here within MiMentor. And realize that all advisors are not created equal, but you have the power to choose your own advisor that you feel will have your best interests in mind. You have the 100% ability to build your very own dream team of mentors and coaches. These are those people that you know will be with you with every success and help dust you off whenever you fall. And you will fall. That's a fact. We all do. And those are the people that will keep you going. Keep them close and keep them updated. And the last word of advice that I have that really helped me grow as a human being is the moment I realized that I belonged, the moment I realized that I was enough. You belong and you are enough. This concept of the imposter syndrome will creep up wherever you are at, from undergraduate to being a chief medical officer of a large multi-million-dollar organization. It's everywhere. And I remember in my medical school training, I learned how to read an EKG from a classmate of mine. He was by far a better teacher of reading EKGs than my medical school professor. I asked him, how is this possible? How did you get to do this? And he told me he's been reading EKG since he was 10 years old with his dad. See, his dad was a cardiologist. His grandfather was a cardiologist. So my first thought was, how is this fair? How do I compete? Do I even belong here? Then I remember going to our rotations in Santa Ana with him and seeing patients that reminded me of home. And that's where I took over, showing him how to work with the Latino population. That was my specialty. I knew then there was a reason I was in medical school. That's when I realized that my lived experiences meant something. You see, your training in being a healthcare professional doesn't start when you go to professional school. It doesn't start when you go to medical school. It started in your childhood with your life experiences. It started with you, with your upbringing, and it'll continue on for the rest of your career. It is something that you will be working on for the rest of your life. There's a reason why they call this practicing medicine. You're always striving to be the better person, the better clinician, the better scientist each and every day. And each of you have a special superpower. Realize it and own it and share it. We belong here. We are enough. And we have superpowers we need to share. And we have communities that are counting on us because we know them well. So if there's only three things you remember from today's talk is the dream starts with you. You have to own it. Stay on your path. It's your path. And realize that you belong. And I just wanted to close by saying that I always get really uncomfortable when people introduce me like today with Vanessa and the list of things on my CV and all the accomplishments that go with that. And I always think like, honestly, who is that person? I'm working on it. I'm working on it. But I'm sure people think, oh, that person has had a pretty successful career so far, must have come easy. Well, these accomplishments always leave out the blood, the sweat, and the tears that we go through in our journey. We condense this and show only the victories, leaving all the failures on the floor. And my CV doesn't have the day that my life hit rock bottom and I was couch surfing because I couldn't find a place to stay. Nowhere in there is a time not having a penny to my name, stressing out and asking myself, how am I going to pay for rent? While walking to an organic chemistry final at Berkeley. My CV doesn't show the countless pre-med advisors that told me to take a different route, that medicine was not for me, that I was too old, that I was too dumb, and that I was too soft. You will not find the 3 failed MCATs on there, and that I fell asleep in the middle of one of them because I didn't sleep the night before. And I was thinking, if I don't do it now, then I'm never going to do it because I'm getting too old. And you won't see the 29 rejection letters that I received when applying to medical school and the countless tears each one of them brought that reminded me that maybe this wasn't the career for me. But we remember all those times that have shaped our life, whether good or bad, like if it was just yesterday. And more importantly, we remember those that were with us to celebrate those times and our amazing mentors. And with every patient interaction now that I have, I bring in all of that life experience. Never forget, it's the idea of transference where I see a family member in a patient I'm helping. I want to go that extra mile. You're going to want to go that extra mile because they deserve it. And my endorphins in clinic go crazy. I love clinic. And my favorite part of clinic, just before you knock on the door, and I think about how I'm going to treat that patient on the other side. And when I go in and enter the room and I hear that click in the closing door, that's when that magic happens. It's such a beautiful thing. I want to share that with you. I don't want to keep this to myself. And you have chosen what I feel is the greatest career and one that I'm so proud to be a part of, to have the ability to walk into a room, sit with a patient and just listen. That is priceless. As a doctor, a nurse practitioner, PA, you have the ability to make sure that your patients have the best care possible. and that they feel supported throughout their life's journey. So your future patients, I promise you, are waiting for you. I'm telling them all about you. I'm telling them about what you're doing. And I know they're going to love meeting you. So it's been a tremendous honor for me to be here. I thank you for your time and I wish you all the best. God bless you and God bless me, mentor. Thank you so much.
Incredible. Thank you, Dr. Angulo. Thank you so much for being here. We're so honored to have you share space tonight. And again, thank you for all the support you have provided for MiMentor a través de todos los años. We thank you from the bottom of our heart, and hopefully everyone takes this message and has it resonate with them from this point on forward. Remember, you can, and if not you, then who?